Welcome, Debbie Matthew here. I'm going to give you a little instructional video here for breathing well. So many people have breathing irregularities, and this can result in instability, mentally, emotionally especially. So if you have anxiety off or on or constantly, depression, the essence of the deep breathing process will really help to correct these mental, emotional, psychological challenges. So we want the breath to go deep into the abdominal area and not to be primarily in the chest, which is a ongoing challenge for many people. So if you think about a baby and how a baby breathes, it's really abdominal. We want to get back to that state. So I want you to bring one hand on the abdominal area, so part of the palm is over the navel, and it's just kind of in that soft area, and the ribs are on either side of that, and this is in alignment with the deepest part of where the lungs can go down into when the diaphragm, the horizontal muscle layer, is really working effectively to push down from its umbrella shape into a more flat shape, and then that expands the whole rib cage. So I want you to bring one hand on this abdominal, the middle third of the torso, if you will, on that area, and the other palm on the chest area. And then just breathe naturally. I'm assuming you're breathing through your nostrils, and if you're not, if there's some blockage there, then that can be another challenge. But try to breathe through the nostrils. If there is quite a blockage, then breathe through both the nostrils and the mouth. But primarily, if you can, shift entirely to the nostrils. And then exhale. And start to breathe through the nostrils. Inhaling, drawing it down into the hand area that is at the middle third of the torso, the abdominal area. And just notice if you can expand the ribs and expand the soft belly into the hand that's there. And as you exhale, release and let that breath come back out and the belly pull back towards the spine. Notice how much breath as you take slower, deeper breaths is actually coming into this middle abdominal area. I'll call this the belly, middle belly, relative to how much goes in the chest. Use a little pressure with the hand on the belly so it connects with the muscles, and you can start to push the muscles out, and that will help you get awareness in this area, especially if it's quite frozen, if it doesn't move very well. If there's a lot of breath, or primarily it's coming into the chest, then your main focus is to notice and feel the breath and pull it down into that deeper area. I want you to be able to feel the belly expand forward. Pressure into the hand pressure into the belly. And when you exhale, nice and smooth, and squeeze it back towards the middle body, towards the spine. So just slowly increase how much breath comes down into the belly. If you can completely remove the breath from the chest, that just gives you another way to manage bringing the breath down into this area. What we're looking for over time is 75 to 80% of the breath coming into the middle torso area, this diaphragmatic breathing as it's called, 20 to 25% into the chest. So if you observe my hands, I'm going to bring them both in the belly area now. You'll notice how in this neutral area, that the hands are just kind of flat, fingers more or less together, and then when I breathe in, they expand. Once you have the rhythm of this and you're starting to feel how to bring the breath down into this area, or if you already can, but there's still quite a bit more in the chest area, just practice bringing it so that in that ratio, as I mentioned, 75 to 80% is in the belly, 20 to 25% in the chest. That's what you're looking for. So if you practice this, and I would recommend doing 5 more minutes now, 5 minutes of this practice 3 times a day. Transition times are great, maybe before lunch, before dinner, right first thing in the morning when you get up, or before bed at night. Excellent time to practice this so it becomes your base breathing method. So again, you're going to breathe in through the nostrils, slowly over time, just increasing the length, the smoothness, pulling 75 to 80% into the belly, 20 to 25 in the chest, and then as you release, slowly release it, squeezing it in a little bit more than you normally would, so that you expand the range of motion for your diaphragm, for this breathing organ. And when you practice, make sure before you start, just to set an intention that you want to breathe more deeply to feel better, and also to notice how you feel before and how you feel after.